Go live. Go live.
Okay, so thank you. Welcome to our bi-monthly medical forum talk series.
Go live.
We are glad that we have Epstein today for our topic today. So our topic will be today physician mindfulness, and I'm going to introduce Dr. Epstein. So Dr. Epstein is a great family physician, teacher, researcher, and writer. He devoted his life to understand and improve patient-physician communication and clinical mindfulness. His groundbreaking research on communication in medical settings and innovative educational programs have been among the most widely cited in the medical literature and have a major impact on thousands of medical practitioners and trainees. So his 1999 JAMA article on mindfulness practice with Mick Krasner, he developed mindfulness practice workshops, which have helped clinicians worldwide experience greater self-awareness, resilience, joy, and effectiveness in practice. In addition, he co-directs the Center for Communication and Disparity Research and Mindfulness Practice programs at the University of Rochester School of Medicine and Dentistry, where he is a professor of family medicine, psychiatry, oncology, and palliative care. He's a graduate of Harvard Medical School, and he's a recipient of numerous Lifetime Achievement Awards relating to communication and humanism. So he has published over 300 articles and book chapters. His first book, Attending Medicine, Mindfulness and Humanity, was released in January 2017 to wide critical acclaim. So without further ado, I will leave stage to Dr. Epstein.
Well, thank you very much. I really appreciate the kind introduction and being able to be here with you today. The reason I'm talking about mindfulness is and mindful practice is because I think it's one of the fundamental skills that we all need as clinicians, and especially now because the healthcare situation, the healthcare systems are in a particular state of chaos and uncertainty, much as the rest of the world is. So it's kind of a bit of an arrogant title to say that I'm going to try to help you flourish in these really troubled times, but I'm going to do the best I can to try to give you some context about an aspect of medicine that I think is often not given its due. So I'm just going to give you a little bit of context about who I am and where I live and that. So the photograph that I took when I was preparing this talk, which was about a month ago, looked like this. And this is my house. The snow is all melted and the daffodils are coming up, so it looks a bit more spring-like now. But if you look all the way to the left, and there's a door, a glass door with light coming out of it. And if you looked in that door right now, you'd see me. So this has been my home office for the past 2 years or so since the beginning of the pandemic, when I'm not actually in the hospital seeing patients on the palliative care service. So this is my other life. And one interesting thing about these photographs is that over the past 2.5 years, I've often wondered, even though I'm usually the person standing up, that I could also sometimes just as easily be the person in the bed, that sense of vulnerability, that sense of fear that COVID might take its toll on me personally and my family was really quite present for me, and as it has been for many of you. About a month before the pandemic started, my first grandchild was born, and she lives in Los Angeles. I live in Rochester, New York, so pretty far away. And so it's been disruptive for family as well. We haven't gotten to see her as often as we would have otherwise wanted to. And at the other end of the spectrum, my mother, who is now 88 years old, this was taken about maybe 7 or 8 months ago, is now suffering from dementia and stage 4 lung cancer and trying to navigate, and she lives in New York City, and trying to navigate the healthcare system in New York City, which is 350 miles from where I live, has been a challenge, especially during times of COVID. So this is not just a professional set of circumstances, but also very personal ones. So before I start talking about mindfulness and talking about burnout and well-being, I'd just like you to engage in a little exercise with me. And I'm going to propose that you imagine what it means to flourish, even in these times. So let's imagine that it's now 2 years from now, it's 2024, and the pandemic, rather than being as acute as it is now, has kind of died down enough so that we begin to feel that life is has some predictability to it. And imagine that you're looking back, okay, at the past 2 years, the pandemic and then since. And imagine that you feel that you've navigated the current crisis to the best of your abilities in such a way that you were able to be attentive, energetic, creative, resourceful, robust, compassionate, and not just in your healthcare domain, but also with your friends, families, patients, and colleagues. So when you're thinking about this, when you're thinking about how you have managed to not only survive, but do a reasonably good job during this time, think about the quality of your mind when you're working at your best. Is it that you're focused? Is it that you can see the big picture? Is it that you have patience? Is it that you have a good knowledge base? But think about your quality of mind, your emotional mind, as well as your intellectual or problem-solving mind. Then think about the strengths that you have. What about who you are, your skills, your beliefs, your qualities and virtues? What is it that enables you to be at your best? And then finally, what's been your growing edge? What qualities have you had to learn? What skills have you had to learn? And how did you learn them? And the reason I'm starting here is that I believe that mindfulness involves qualities that we all have. That is something that's naturally occurring. And our job really is figuring out how to bring those to bear when they're really most helpful and most needed. Because often when we're feeling frightened or uncertain, we tend to fall back on the familiar, and we lose that capacity for creativity and resourcefulness. One of the best definitions of mindfulness that I've read is by someone who probably never used that word. Ronald M was a psychologist who lived in the 1960s and 70s, and he wrote at one point about human freedom, and it involves our capacity to pause between stimulus and response, to take that moment, and in that moment, in that pause, to choose the one response towards which we wish to throw our weight. And so if during your workday you have some unpleasant event, some unexpected tragedy, some conflict, to use that, to those times to create a pause in which you can reflect, and reflect quickly so that you can act in a way that's most concordant with the values, most concordant with who you are, most concordant with why you went into medicine in the first place. In the 1990s, I started writing about mindful practice, and I defined it as moment-to-moment purposeful, that is on purpose. It's not something that just happens to you. Attentiveness to your own inner life, your own physical and mental processes during everyday work, with the goal of practicing with clarity, competence, wisdom, and compassion. So it's pointing towards something. Mindfulness is a vector. But just unpacking mindfulness, a lot of people think when they hear the word mindfulness, they think about meditation, they think about quiet places, beautiful scenery, and that's all lovely. But in our work lives, this is where mindfulness matters the most. I mean, imagine what a code would be like if it was mindful. Imagine dealing with a highly charged conflictual situation in a mindful way. There's been quite a bit of observational and also interventional research on mindfulness over the past 20 years, applying to healthcare settings. And it seems that people who are either naturally mindful or do some kind of practice to help them be more mindful are more resilient, have less stress and burnout, are more attentive, have more positive emotion, are able to make better decisions, that is, not being biased by prior experience, and also being more flexible, have greater comfort with uncertainty. Mindful teams in the hospital have patients who fall less often, fewer needle stick injuries, fewer medication errors. And mindfulness is associated with empathy, patient-centeredness, communication, community, and also less implicit bias. So the challenge there in practicing mindfully is to improve clinician well-being, to improve the quality of care, and also the quality of caring, the relational aspect of mindfulness. So the first component of mindfulness that I'd like to talk about is attention, how you pay attention and what you pay attention to. So during my dermatology rotation as a medical student, I was in Boston and I would take public transportation. And I realized at one point that I stopped seeing people's faces. I only saw zits and moles and pimples and other lesions. And so realizing at that moment that my medical training altered the way that I saw the world. But the way that we see the world is always imperfect. And as William Osler said, that we often make more mistakes by not noticing things, by not seeing, than by not knowing. And importantly, the essayist Anais Nin said that we don't see things as they are, we see things as we are. Okay, so we bring ourselves to our perceptions. So take a look at this photograph. This was taken during Superstorm Sandy that ravaged the East Coast a number of years ago. And think about the words that come to mind for you. This is a pretty turbulent scene. You kind of worry a little bit about this pier. You think it's going to withstand the waves. Some people would say it's violent, dangerous, scary. Okay. And this is a photograph taken on the same beach, same storm. And let's assume that this young surfer is neither suicidal nor psychotic. And now he's looking for an adventure. You know, he's taking some precautions. I can see that the surfboard is attached to his leg there. But he's looking at these same waves that we saw over there, and in them he's seeing adventure, right? So when you go to work Monday morning, does work look more like that, or does work look more like that? And I'll venture to say that both are true. Both are part of. So if you're able to see both sides of a situation, it'll enrich the possibilities and enrich what you can bring to yourself and also bring to your patients. So we've got attentiveness. The second aspect is curiosity. And it's very easy to be curious when you're in a peaceful and safe environment, but much, much more difficult to be curious when you're feeling threatened, when things are chaotic, and people are afraid. So part of the trick is curiosity in the face of fear. In Zen Buddhism, there's an idea that's called beginner's mind. And it's the capacity that we as experts can take to take a step back and see a situation with new eyes, just to expand the possibilities that we use in looking at a familiar or unfamiliar situation. So I think about when I had a primary care practice for 36 years, and I had some of the same patients for 36 years who had some of the same problems for 36 years, or same complaints for 36 years. And so it's difficult actually to take a beginner's mind when they come in for their 400th visit. But if you don't do that, then you run the risk of missing things and misunderstanding and making assumptions that aren't true and engaging in a kind of self-deception. So beginner's mind is kind of like this. It's being able to see a situation from more than one perspective at the same time. And finally, this is a painting done by the Spanish painter Francisco Goya of his doctor. Now, Goya got seriously ill in the year 1819 and managed to recover and was very grateful to his doctor. He doesn't look very healthy in this picture. And you can see the doctor is not only giving him his medicine, but also is really literally supporting him. And this picture, in my view, connotes presence. It connotes being present, being there, fully, not distracted, not phoning it in, but really being. And the inscription at the bottom, Goya writes, to my friend, Dr. Arrieta, in gratitude. And I find it really striking. He calls Dr. Arrieta his friend. And I think that in clinical care, there's a particular kind of medical friendship that I think we need to all have so that we can fully care about and care for those we encounter. So before I mentioned that one of the goals of mindfulness is compassion. It's not just compassion towards others, but it's also compassion towards yourself. So we can define compassion as suffering with, or a feeling that arises in witnessing suffering that motivates a subsequent desire to help. But that compassion can be directed towards a patient, towards a colleague, towards a family member, and also towards yourself. And part of the goal of medicine, I think, is for healers to learn to care for themselves with the same exquisite and observational and curiosity and beginner's mind and presence that they would bring to the care of patients. And compassion is not quite the same, but similar to sympathy and kindness and caring and tenderness and warmth and pity. But compassion's in short supply. A study done by a colleague of mine, Beth Lown, she surveyed 800 recently hospitalized patients and 510 doctors, and the vast majority of patients said that compassion is very important to successful medical treatment. But nearly half of patients think that the healthcare system generally doesn't provide compassionate care, and patients think that health professionals generally don't provide compassionate care. So healthcare systems and health professionals aren't as compassionate as we think we are. So I'd like to now unpack the part of the reasons why we are often not mindful in the way that we aspire to be, why we're not as attentive or curious or present or compassionate. And so this is a painting of Prometheus, who was a Greek god, and he brought fire to humanity. And Zeus did not like that, and had him chained to a rock, and every day an eagle would visit him and peck at his liver. And so I ask doctors often, what's pecking at your liver? What are the things that make your life, your work life, difficult or even toxic? And you can read the list: distractions, interruptions, multitasking, productivity, time, staffing pressures, dysfunctional computer systems, too many administrative tasks. I mean, primary care doctors spend more time in front of the computer than in front of patients. And it leads to a kind of moral distress where we feel we're not doing the job that we're meant to, feel a lack of control, a high degree of responsibility, feel isolated. In my view, many of those, or actually all of those, are fixable. The only one that isn't is that medicine is intrinsically emotionally intense and unpredictable. And that's something that's just part of the nature of the work that we do. And I'd just like to share with you this drawing that was done by a child of her pediatrician visit. This was actually published in JAMA by a colleague of mine with an accompanying editorial that said the cost of technology. And if you look on the left-hand side, you see the doctor there looking at the computer, back to the patient and family. And this sense of disconnection is really something that many of us feel. Now, empathy is a good thing. It's a way of connecting with people, of understanding their situation, their pain, attuning yourself to others. But empathy can also be a source of distress. This is a self-portrait by the Mexican artist Frida Kahlo, and she had a spinal injury when she was quite young, had a fractured spine, and she actually calls this self-portrait the broken column. And this is a disturbing picture. I think she so effectively tells you what it's like to be living with chronic pain. And the way her eyes look at you, you can't look away. It's difficult to avoid her gaze. And Eric Larson, in an editorial in JAMA a few years ago, described sometimes that empathy is a form of emotional labor. It's a willingness to subject one's mind to the patient's world, and sometimes it produces distress in us that makes us want to withdraw as opposed to engage more with patients. And we're talking about empathy and compassion, because there's the issue of tribalism, that it's much easier to empathize with those who are close to us or who we perceive as similar to us and have similar values, look like us, talk like us. And I think we've seen a lot of that fractiousness, that tribalism in the US recently and globally as well, that people during these frightening and uncertain times have tended to aggregate with people who are like them and reject people who are different. And when we're thinking about someone else's suffering, we have to look at our own judgments. Do we ask ourselves, is the suffering serious? Is the suffering real? Is the suffering the person's own fault? Are we making judgments about that person that might get in the way of our caring for them? And the self-awareness that it takes to recognize when we're making judgments about others and the impact it might have, not just on social niceties, but even the quality of care that we provide. We know that implicit bias leads to a lower quality of care. And are you overwhelmed? Are you in a hurry? Do you feel you can listen to this person? So all of those things are worthy of our reflection. And I want to speak for a moment about uncertainty, because there are different kinds of uncertainty. In medicine, we're used to the kind of mathematical or aleatory or stochastic uncertainty, where there's a clinical trial and it shows that a particular treatment works in 70% of people and it doesn't work in 30%. And so we know what the parameters are and we know what the chances of this particular patient responding to the treatment. But the kinds of uncertainties we've been dealing with lately, not only in the healthcare sphere, but also in the political realm, is what's called epistemic uncertainty. We don't even know what the rules are. We don't know what questions to ask. We don't know how to make predictions. We don't know how safe tomorrow will be compared to today. We don't know which masks work well or whether it's worth getting a fourth vaccine dose. And so those epistemic uncertainties raise our anxiety level. And what tends to happen, according to a theory called terror management theory, is that when we feel threatened, when we feel that we might die from the result of these uncertainties, that we tend to affiliate with people who share our worldview. We tend to reject people who don't. And we also try to do things to help us ourselves be remembered by others. Again, this is a kind of closing off that I just invite you to think about who's in your bubble and who's outside of your bubble. Actually, I want to go back to this slide. There was a study done of divinity students studying for the priesthood. And they were studying the story of the Good Samaritan, a biblical story in which someone stopped to help a person in need after two others had passed him by. But they did a psychology experiment in which they actually had an actor wear clothing, making him look like he was homeless and injured and uncomfortable, and had him lying on the sidewalk. And the divinity students were in one building, and they were told that they needed to give a lecture about the Good Samaritan at another building on the university campus. And in order to get from point A to point B, they had to pass this homeless, disheveled person asking for help. Half of the students were told that they had plenty of time to get to the lecture hall to give their lecture. And the other half of the students were told that they were running late and had to rush. And guess what happened? The students who were told they had lots of time stopped and offered assistance more often than those who were told that they needed to rush by. So haste is something that is antithetical to being mindful and in some ways compassionate. So we've developed programs. I say we, Nick Krasner and I have developed programs for mostly physicians, but also other healthcare professionals to help them be more mindful. We teach them different kinds of contemplative practices, including meditation. We teach them to listen deeply to one another. We have them write stories about difficult moments in clinical practice and listen in such a way as to understand more deeply and not listening to try to solve problems or to come up with solutions, just to listen to understand. And at the end of the workshops, before and after workshops, we surveyed the physicians to see what the impact had been. And you can see on this slide, this is the only slide I'm going to show you with lots of numbers, is that burnout improved, well-being improved, compassionate care improved, job engagement and satisfaction improved, teamwork, positive emotion, and stress-related symptoms also improved. Interestingly, a couple of things didn't change. Their rating of the work environment, their rating of feeling valued by their organization, and their rating of how likely it would be that they might seek another job. And so these are things that healthcare organizations need to do that individuals really can't necessarily influence. It's the environment also that matters. So what is it about being mindful that promotes compassionate, patient-centered care? Well, one is that you learn to focus your attention on the things that matter the most. That enables focused and peripheral vision, welcomes surprise and novelty and creativity as opposed to being fearful of it, helps you regulate your emotions so that you're less defensive and more curious in the face of fear. It enables you to see something new in the familiar. So to see that patient you've been caring for 30 years and learn something new about them. To take more than one perspective, to see others as they see themselves, to see yourself as others see you. And then what I call moral maturity is throwing one's weight towards what matters most, awareness of and reduction of implicit bias, stereotyping, tribalism, seeing others as like you. So it's more being non-judgmental. So what do we do? How can we promote these qualities of mindfulness so that we can have more effective, compassionate healthcare and not burn ourselves out in the process of doing it? So I have three things that I'd like you to remember. The first is find something to practice, even though you're already perfect. The second is to listen deeply, especially when you have no time. And the third is to create community. So the first thing to practice is to practice awareness. So when you are under stress, and what's your earliest warning sign? What's the first thing that happens to you when you're under stress? What happens in your body? Do your shoulders get tight? Does your stomach growl? Do you get a tremor? Does your heart skip a beat? Do you get a headache? Do you feel dizzy? Do you feel like running out of the room? Okay, so what do you feel in your body at those times? What emotions accompany those signs of stress, and what thoughts? And the reason this is important is that these feelings are all very unpleasant, right? No one likes to feel stressed. But it's equally important to recognize those feelings when they're in their early stage before they get out of hand. Because all of us, being the resilient people that we are, know how to handle stress pretty well when it's manageable. But what we often do is forget to manage the stress when it's at a low level and allow it to escalate and amplify. Another thing you can practice is practice attention. So I'll ask you, do you have 2 minutes every day in which you can pay attention to your own inner life? That is, how's your body today? How's your thinking today? How's your mind working today? Are you focused? Are you distracted? So just paying attention. Are you breathing today? Is your breathing relaxed? Is it breathing fast, breathing slow? A third thing you can practice is kindness. And I'd like to read you a short poem. This is by an American poet named Naomi Shihab Nye. I say American. Her origins, she lives in Texas now, in Austin, but her background is Palestinian, and she's traveled quite extensively through South America and other parts of the world. This is a particularly poignant poem. It's called Kindness. Before you know what kindness is, you must lose things. Feel the future dissolve in a moment like salt in a weakened broth. What you held in your hand, what you counted and carefully saved, all this must go so you know how desolate the landscape can be between the regions of kindness. I'm going to stop here because I'm going to just tell another story. A couple of years ago, before the pandemic, had an episode of abdominal pain. It was quite severe. I went to the emergency room and everyone did their job perfectly well. The doctors, the nurses, the techs. But the one person who stood out for me in that emergency room visit was the person who wheeled me. It was the transport person. So I was lying there flat on a stretcher, looking up at the ceiling. And this transport person was taking me to the CAT scanner from the emergency room. And at a certain point, he just stopped and looked me in the eye and said, "How are you doing?" And I think he had some idea that each time that the gurney went over a bump, that it somehow, was not pleasant for me. It was uncomfortable. But that moment really stuck with me and made me feel that, that I was being taken care of, feeling that I could trust this emergency room. It was the emergency room where I had worked in for a long time, but which in a way made it more scary because I knew all the things that could go wrong. So that desolate landscape was the emergency room. It was the CAT scanner, but that region of kindness was just right there with that transport person when he looked me in the eye. So the poem continues, how you ride and ride, thinking the bus will never stop. The passengers eating maize and chicken will stare out the window forever. Before you learn the tender gravity of kindness, you must travel where the Indian in a white poncho lies dead by the side of the road. You must see how this could be you, how he too was someone who journeyed through the night with plans and the simple breath that kept him alive. Before you know kindness as the deepest thing inside, you must know sorrow as the other deepest thing. You must wake up with sorrow. You must speak to it till your voice catches the thread of all sorrows, and you see the size of the cloth. Then it is only kindness that makes sense anymore. Only kindness that ties your shoes and sends you out into the day to gaze at bread. Only kindness that raises its head from the crowd of the world to say, "It is I you have been looking for," and then goes with you everywhere, like a shadow or a friend. So practice kindness, practice attention, practice awareness. And how do you do that at work? Okay, if you don't have time to sit to read a poem, you don't have time to do very much at all, but you do have time for a moment when your hand is on the door handle to take a breath, observe yourself and your surroundings, and decide what you need to carry with you into the room with the next patient and what you can set aside, and then proceed into the room. So this is a practice that I've been doing for the past 25 years with every patient that I see. Stop, take a breath, observe, proceed. And what I've noticed is it makes a difference. I'm able to be more present with the patient and also present with myself. So mindfulness doesn't mean escaping from work, being in some kind of blissful state. Mindful means the kindness and compassion that you carry with you from one room to the next. And so I invite you to commit to doing something positive, one practice that might help you to be more present, more curious, more attentive, more compassionate, more grateful. To choose something small that you'd be realistically able to do, and consider how you'll remind yourself. Okay, so the first principle is practice. Develop habits of mindfulness in the workplace, in everyday life. The second is listen deeply, even if you have no time at all. Okay, we're all rushed. We're all under pressure. So Stephen Covey, who wrote 7 Habits of Highly Effective People, said, most people do not listen with the intent to understand. They listen with the intent to reply. So I'd invite you at moments during the day to find opportunities in which you can listen with the intent to understand. So find opportunities to listen to someone's story, whether it's from a patient or a colleague. But here's a little exercise that you can do. And in the depths of despair of when we implemented our new electronic health record that was kind of stealing my brain, I decided that I would spend the first 90 seconds of every visit just listening to the patient without interrupting, without trying to fix anything, without judging anything, and see what happened. And what happened was that I understood better what brought the patient into the office. I felt that I made a better connection with the patient. I didn't have to repeat questions because I wasn't listening to the answer. And I didn't finish the day any later. In fact, I finished a little bit earlier. That I certainly had time to delve into the medical record when I needed to. So try it with colleagues also when you're in a meeting and someone's talking. Maybe listen for a few seconds more than you usually would. Try it with your own mind. Listen to yourself. Listen to the voices that come from within. And this is something that I do with learners to help them be more mindful, but these are questions you can also ask yourself. I call these reflective questions or opening up questions. Like, if there was something you ignored, what might it be? Or what are you assuming that might not be true? Or is there another way you could see the situation? What do you notice about yourself when you're at your best? And how can you do more of it? So we have practice, we have listen, and then the third part is creating community. And I think of various kind of categories of people that I think it's important to create community with. Those who make you feel more whole. Those who can provide love, wisdom, or insight, or maybe all three. those who may challenge my worldview, even though it might be unpleasant, and those who might otherwise not be part of my bubble. So when I was a student, in order to make money during the summers, I worked as a taxi cab driver in Manhattan, in New York City. That's a really fabulous way of interacting with people who otherwise might not be in my bubble. You know, I picked up people on Wall Street who had more money than anyone can imagine. I picked up prostitutes in Times Square who were living a dangerous and pretty horrible life, and kind of everyone in between. But, and as a primary care physician, the same thing was true. I had incredibly wealthy people and incredibly poor people, people of every ethnic origin imaginable. It was an urban practice. But I think that it's more than just encountering people who are different. It's really considering them part of your community, part of your shared humanity. And my sense is that in creating community, we also create scaffolding for ourselves for the difficult work that we have to do every day. We're all leaders in one sense of the word or another, even if you lead a small team on rounds in the hospital. And these are some things that I think of when I think of mindful leadership: putting people first, seeking opportunities to pause so that people can reflect and really assimilate what the challenge is. Listen with the attention to understand. Ask people, ask patients, ask your staff, ask everyone, what's the hardest part? Address feelings first, then actions. Be realistic, credible, and trustworthy. Be available and present. And cultivate compassion and teamwork through example, not through proclamation. So live the change that you want to see in the world. And then healthcare institutions really have a role in terms of promoting mindfulness and well-being, a very important role, starting from really the basics. You know, like, is the staff safe? Is everyone rested? Are they fed? You know, and is there enough flexibility to allow for people to go to a doctor's appointment if they need to? Do you measure clinician well-being in your healthcare institution? And then what do you do with the findings? In our hospital, the first time they did a survey of clinician burnout, they never released the results to anybody. I think they found the findings too frightening. They're doing a hell of a lot better now, engaging other members of the leadership and trying to do something. But you know, what you measure, you need to share. Human factors design refer to human electronic interfaces, computers, etc. Make them fit the way the mind works, as opposed to having the mind bend into all sorts of contortions to accommodate the weirdnesses of the electronic health records that we have to work with. We spend an extraordinary amount of time doing regulatory crap, stuff that really doesn't matter, that just adds to administrative burden and, in my view, gets in the way of caring for patients. And so now in our institution, we have a committee to try to examine everything regulatory that we need to do and decide what's really necessary and what are ways of streamlining the process. In Rochester, we also have coaching programs for physicians in most of the departments of the hospital, where a coach will follow you around for a day and give you tips on how you can communicate more effectively with patients, how you can make your day less stressful, how you can be more mindful during your everyday work. Creating quiet spaces. So in our busy primary care practice, every day at noon, there is a quiet room where people can go. You can eat your lunch there, you do whatever you want. 3 times a week, there's a brief guided meditation. But it's a space where people can just be quiet. And then there are a variety of forums that we've developed for reflection and self-awareness. One that I particularly like is called confessions rounds, where if there's a mishap, if something goes wrong, you write about it and type it up, print it out in 12-point Times New Roman font, single space. So everyone prints it out with the same font, so you can't tell who's written it. Fold it up, put it in a box, and then once a month at at the confession rounds, someone just pulls one out of the box at random and reads it as if it's his or her own. Okay, so you have no idea who actually wrote that. And it's just a way of dealing with situations that haven't gone as well as they otherwise might, mistakes, errors, conflicts. And it allows people to share in and support one another in a very safe environment. And you can see some other things that institutions can do in a more reactive way, ways of debriefing, offering peer support, time off after traumatic events, what you do when there's harassment or abuse or incivility, dealing with adversity in a curious, supportive, non-punitive way, and also providing access to counseling and coaching in a non-stigmatizing, confidential, and anonymous way when necessary. So those are all things that leadership of healthcare institutions can do to help clinicians be more mindful. So a lot of people ask me how I got into mindfulness and why I'm doing this in medicine. And for me, the story goes well before I entered medical school. I was interested in meditation when I was a teenager. I was interested in Buddhism and other Eastern religions, Hinduism, Islam, in addition to my own Jewish tradition. And started a meditation practice when I was 17. And basically it stuck. It's something that I found to be quite useful, and periodically have spent periods of time doing retreats or more intensive meditation. Not so much in the past couple of years, but and I found it really quite useful in terms of my medical life. And that contemplative, mindful side, I see as an essential skill in any profession that deals with other humans, and also is high emotional valence. You know, it's really difficult what we do. And it's not that we're not resilient enough. It's that we're all incredibly resilient, but it's often challenging to see early on where the warning signs are and how to begin to accommodate to them and deal with the stresses that we're faced with in everyday life. So I'm hoping this talk is of some use in terms of focusing your efforts of wellness towards those 4 goals of being more attentive, more curious, developing a beginner's mind, being more present, and also the 3 ways that you might think about getting there. Find something to practice, something that can be a habit that will help imbue habits of mindfulness. You know, things that you already know how to do. Ways to listen more deeply to one another, colleagues, patients, maybe family, other people in the world. And the third is do what you can to create community, because none of us can do this work alone. So I want to thank you. If you're interested in more information and about workshops that we do, about my book, about to see other talks or whatever, this is my website. You're welcome to be in touch with me through that also. And I believe we have some time for questions, which Dr. Bhatt will be putting into the chat for me to read. So please don't be shy. Just type questions about anything that comes to mind for you, and hopefully I'll be able to provide some answers.
Thank you, Dr. Epstein, for this wonderful talk. Just come to my mind 2 more of a philosophical question. Number 1, do you think the mindfulness is more of an inherited condition or acquired? The second question is, do you think the religious background affects your mindfulness in healthcare professional world?
So can you say the first question again? Because I think I missed a word there. And Okay, I think you're muted. So could you ask the first question again? Oh, okay. Well, I'll answer the second question at this point. Does religion make a difference? I think every spiritual and religious tradition has a contemplative side to it, and I see far more similarities than differences among them. And but the mindfulness that I'm teaching doctors and health professionals, I think really transcends religious beliefs and doctrine, in the sense that the only belief that I think you need to have is that by knowing yourself better, that you can do more good in the world. And mindfulness is one tool, one way of promoting self-knowledge and self-awareness. And so mindfulness is not really promoting any particular belief system. I happen to have been attracted to Buddhism at one phase, but I really don't consider myself a Buddhist. But feel that we have things to learn from a lot of different religious traditions. So the worry here for some people is that that if you strip mindfulness of its religious connotations, that it will then not have an ethical framework. And I think this is something that where in the thinking in the mindfulness community has really been changing, that mindfulness really has to have an ethical framework, because we're really directing that mindfulness towards something that's good and something that matters. So you can, theoretically imagine a very mindful assassin, for example. We're not really training people to be assassins, we're training people to be healers. So mindfulness is more, what I'm thinking about is more that it's right mindfulness. It's pointing towards something that's good, that we all agree is part of our mission as health professionals. I hope that helps you. Are there additional questions?
Emre, do you have any other questions that posted into the YouTube chat?
Oh, here we go. What advice would you give to incoming residents? I think that adopting some practice that allows you to be in touch with who you are as a person on a habitual way. So, but something that doesn't take time. Okay, so with the practice of just stopping briefly before you enter a room, taking a breath, and making a decision about what you need to carry into that room with you might be an example of a practice like that. Because it really doesn't take time. It takes, maybe half of a second. But it's some way in which you can remember what's the most important thing for you right now, and also helps you to discern what skills you really need to address the problems that the patient is presenting to you. Other things that I did as a resident, actually continue to do to some degree, is making a separation between work and home. So when you get home, change your clothes. Don't eat dinner at home in the same clothes that you've been working in. It sounds kind of like a silly thing, but it can be really powerful if you kind of know that you have your work clothes and you take them off, and now you have your home clothes and you can be with whoever your family is, or even if you live alone, the time and space is yours. So I guess those are two things that I would suggest in terms of being more mindful, entering probably, which is going to be one of the more stressful times in your career. If there are no more questions, I guess I can just offer you some words of thanks for inviting me, and hoping that you all do well and be in touch.
Thank you, Dr. Epstein, and this is a wonderful talk. And do you mind to share your email address? Maybe I missed that part.
It's best to contact me through my website, and then there's a contact portal through there. So it's Ronald Epstein, all one word, .com. It's really simple. It's my name.com, ronaldepstein.com.
Okay. Thank you for everyone listening, and thank you, Dr. Epstein, again for your nice presentation. So,
Take care. Bye-bye.
okay.